Shan-Estelle Brown, PhD, is a mixed methods medical anthropologist, an associate professor of anthropology, and coordinator of the Global Health Program at Rollins College in Winter Park. She is a fellow of the Robert Wood Johnson Foundation's Interdisciplinary Research Leaders. Previously, she was postdoctoral research associate in the AIDS program at Yale School of Medicine. She's originally from Connecticut. She was on a pre-med track during her undergraduate studies, intending to be a clinician or writer for a medical journal. Doubtful of whether becoming a doctor would produce the best quality of life, Dr. Brown said she resolved to go a different direction, medical anthropology. And to quote her, she said, "If it's not for you, then there's another pathway. You need to figure out what that is to get where you want." Dr. Brown wrote her dissertation on sickle cell disease, which she worked on in Guadeloupe. Sorry, my brain made it pronounced differently in my head. She chose this location to see how the disease was treated in a country with a predominantly black population, away from many of the discriminatory barriers of the United States healthcare system. Brown later joined a research group as a postdoctoral research associate at Yale School of Medicine as part of the AIDS program. Her book, Writing in Anthropology, A Brief Guide, was published in 2017 by Oxford University Press. Her research interests include community-engaged research, patient-centered outcomes with medical technology, patient perceptions of risk and well-being, and structural facilitators and barriers to healthcare. So please welcome Dr. Brown.
How's everybody doing? Thank you for being here. I know that you just are coming off of Free Flow, so show of hands if you attended Free Flow. Well, thank you so much for taking another weekend to stay in the same orbit and to hear this presentation. This talk is called "Why Doesn't Everyone Have Excellent Health?" And I wanted to start with just a definition of health so that we would all be on the same page. And this is actually where I start. I teach Intro to Public Health every single semester at Rollins, and what's surprising is that it doesn't get old. And it's because there's always, unfortunately, some new crisis, but there's also new, there's always new information that's coming out, there's always new issues, and so I genuinely thought that it would get old, because it's the same topics over and over again, but it never has. So what is health, right? As you can see here, the World Health Organization is defining it as a dynamic state of complete physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity. And this definition in and of itself is kind of revolutionary, because what came before it was simply this definition of the absence of the absence of disease, right? The absence of infirmity. And so the 90s was an important kind of time for the World Health Organization and just the health community in general to think about a more holistic idea of what health is. And that actually has now paved this way for thinking about things like the social determinants of health, right? So the factors that are in a person's environment that affects their health, and not just, for example, just genes, right? Which is actually where we're going to head, right? We're going to talk about these social issues that relate to health. So if you know me really well, as far as the kind of data that I like, I don't like pie charts. Why don't I like pie charts? I don't like pie charts because, it's funny, you start a presentation and I launch into what I don't like. So I don't like pie charts because it's actually really hard to see the comparative size between things that somebody's trying to show you. But this is the most convenient way that I can borrow pictures from the internet in order to make the point. So the World Health Organization has identified that yes, your genes are an important factor, yes, your physical environment is an important factor, but there are health behaviors, right? So the things that each person does have control over, and then there's also these social and economic factors that most people technically have control over, right, at the community level, but generally it's like the water that they're swimming in, right, or that they're drinking, and just their overall environment. That is changeable, right? What we've found through data is that although there's a lot of emphasis on genes and predetermination as far as what somebody's health can be, it's actually the social factors and somebody's health behaviors. So in health, in medicine, there's a lot of emphasis on trying to make sure that people eat right and things like this, right? You've all heard this from your own medical providers. But what there's not as much emphasis is on this 40%, right? The social and economic factors, which actually have a really serious impact on the health of individuals and then also of communities. So in general, right, and this is something that the World Health Organization has set up, has established that these are the necessary conditions for health on the right-hand side. And if you think about it, it's like, well, of course, these are the things that make sense, right? You need to be able to live in peace. You need to be able to have food. You need education, right? You need choice, right? You need to be able to do what you generally want to do, and you want to be able to do that in a place that has justice and that is also equitable. Sounds simple, isn't always easy to come by, right? So we're going to spend a little bit of time first just talking about life expectancy. And so life expectancy is something that comes up often in the news, and I'll show you some of the kind of newest issues that are coming up with US life expectancy. This is basically a projection, right? And so it's an estimation that actuaries love, but humans generally don't, right? Because it's predicting how long somebody can live based on the year that they were born. So in the year 1900, your average person in the United States would live to be 47.3 years, right? And that's on average. Certainly there are people who were born in 1900 who lived longer than that. There are also people who lived shorter, especially if you think about how in 1918 there was a flu pandemic, there was also world wars, right? So there's a lot of factors that may have cut people's lives short, same as today. By 1996, right, so you fast forward almost 100 years, the average life expectancy nearly doubled to 78.1 years, right? Which is phenomenal and amazing, right? And so there's always this kind of jockeying for dominance between the public health community and the medical community. They're technically on the same team, but they actually see things very differently, right? Their priorities are a little bit different. So in the medical community, the goal is to diagnose and treat, and then prevent. And in the public health community, it's prevention first. So over the last 20th century, there have been a lot of public health advancements, and of course this is a slide that I've taken from public health. So of course what they're saying is that it's the advancements in public health, not medicine, don't worry about them, that they are the ones who are responsible, right, for all of these really fantastic advancements. And that would be things like sanitation, that would be essentially think of these like large public works, right? So the things that we have that we may not have had that still some people in communities are trying to have right now, right? So your running water, your clean air and clean water, your what's we're looking for? So certainly advancements in trying to prevent chronic disease and trying to treat that has prolonged people's lives. There's also, I'm trying to think, there's actually like a top 10 list of these major public health advancements. It includes vaccinations, right? Maternal mortality. And so these are some of these things that in public health, in their universe, that they account as being the things that have prolonged human life on average. So that doesn't mean that every single person is going to have the same life expectancy, right? So it does differ based on sex, right? So in the United States, on average, women tend to live longer than men on average. And then inside the box here, I just wanted to list that there are also some life expectancy differences depending on race/ethnicity. So if you look, and this is data that's come out from the NIH in the last couple of years, and what they're saying is that overall life expectancy has increased from the year 2000 to 2019. So over 20 years, life expectancy has increased, which is great, but it hasn't actually, not every single group has experienced those benefits. And that is in part not necessarily due to biology, but is due to some of these social factors. So what's happened most recently, right, and I want to make sure that you have like the freshest news, is that life expectancy actually dropped for the second year in a row in the year 2021. So why would that happen? It's a few things. One of it is that we still have a problem of maternal mortality in this country. We also have an opioid epidemic that continues to be problematic, especially with the rise of fentanyl, which of course you only need a tiny amount for someone to overdose and die. And then there's also, of course, the COVID-19 pandemic. And so when you put those things together, this is the reason why, even though the years for life expectancy have continued to climb for Americans, everything has kind of come to a halt. And now it's starting to go, the average is coming down, which we should be concerned about. So I have dots for you. So this is a graph that was created by the Commonwealth Fund, but it's using data from the World Health Organization and a couple of other sources. And what it's showing you here is that, and I'll show you the title of the piece, but it is actually this. It says, Americans in most states are expected to live shorter lives than people in other countries. So I'm gonna actually switch over in a minute to the interactive version so that you can see the dots. But this first line are EU countries, and this next line are non-EU countries. So if you think about it, these are, compared to the United States, countries with similar gross domestic product, right? So these are considered our peers. And then these blue lines are states. So the top dots are countries, and the bottom four lines are states. And if you look, it's split by region. And then along the bottom is life expectancy at birth in years. And so if you look at some of these dots, no matter what area, or in each of these is a state, so no matter what state you live in, there are a whole set of countries on this planet, even though the United States is the richest country, where you have people who are living longer lives on average. So let me just switch real quick and I'll show you the dots moving this time. So here's the same graph. And I know you want to know what's on the end. So that's Spain. This is Italy. This is Japan. Here's Switzerland. Okay. And so South Florida is in here somewhere. I'm trying to remember which one it was. There's Florida. So the average life expectancy at birth is 79 years. And then if you look, with the US South in particular, right, these dots actually are much more spread out. And anybody want to guess what's at the far lowest end of life expectancy? Mississippi. Ah, you know, yes, so it's Mississippi and West Virginia, right? But then think about it this way, right? These are just averages. Remember we were just talking about how depending on your sex, depending on your overall income, your race, right, which is also tied to income in this country and wealth, the life expectancies are going to be even lower for people, right, than these average of 74 years. So that, of course, begs the question of why isn't life expectancy of Americans as high as these peer countries? So to answer that question, I have another question. What kind of community do you want to live in? And then what do you want for people living in other communities? So what kind of community do you want to live in? And what do you want for other people living in their communities? Okay, so it's not actually a rhetorical question. You get like 5 seconds to think about it, and then we're gonna take hands. Anybody have a thought?
Safe space.
You want safety? Yeah.
I would want the same for both of them.
Same.
You want the same for both? Okay.
Yeah.
Other folks feel like it should be the same? Yeah. Anybody want more in their community than they want in other people's communities?
Progressive rather than MAGA.
Okay. Okay. Going political? Yes.
I think if people realized what average was, they might feel differently.
Well, that's true. Absolutely. Yeah. So keep these two questions in mind. All right. This is just a really fun infographic that illustrates this answer to the question, what makes a healthy, resilient community, right? Also just notice that I'm not necessarily talking about individuals, right? Individuals certainly make up communities, but I think it's really important to just start thinking about things at this community level, because it's what's in a person's community that makes all of the difference as far as what their own life trajectory, right, and their highest health that they can achieve. So some of the things on this list are things like access to recreation and open space, right? A lot of these have access in front of them, which I think is important, because what that means is that there are people who are living without access, right? And we have to talk about establishing access before we can even talk about quality, right? And so I think that's what's really important here. So having access to some sort of green space, right? And some sort of sustainability that's built in an environmental way. Access to economic opportunity, a completeness of neighborhood. So what that means is, can you do all the things that you need to do in your neighborhood? By essentially like staying in the same town, right? In the same community, in the same space, right? Can you walk to find food and pass a green space and find some healthy food and maybe also see a doctor if you needed to? Can you do all of that in your own community? Because certainly there are lots of places that don't, right? And so here's the blueprint, right? It's very simple. It fits very neatly on an infographic, right? If you think about your own communities, you know, just looking at the slide, you may be thinking about, well, what do we have, right? What do I have in my own community? Do I have all of these things, right? So keep all of this in mind as we go. So it's a common fact in public health and in medicine that you can predict somebody's health, you can predict their race, and you can predict their life expectancy just by knowing what their zip code is. So why would that be the case, right? The reason is for all of those things that we just talked about with what goes into a healthy community, and also remember all of those early things on the earlier slide about what is just necessary to have health, right? Peace, justice, equity, right? Fairness. So again, these are some of your basics that you see that are those same hallmarks that were so important in the 20th century that were established that people still don't have, right? So that would be things like nutrition, sanitation, what's actually in the physical environment, right? Are there buildings on fire, right? Even if they're not even necessarily on fire, if they're not safe, they might as well be on fire, right? It's not that different. Who has health and who doesn't, right? What kind of access do people have to medical care, right? How much structural discrimination does somebody experience? And I say structural there because this is not about the interpersonal discrimination that somebody might experience, but more, how does the actual setup of a particular environment, of a community, act in a violent way on a person that would keep them from being safe and from being able to stay healthy. And then another piece is about social support and how important it is. And I really appreciate, Jocelyn, that part of what your group is doing is fostering social support, right? Because you're trying to get people to come together and even just do a thing, right? That is part of health, right? And I think you'll see as we get through this that, like, to me, everything is health, and I'm not the only person who thinks so, but this is that. right? So lower socioeconomic status is associated with increased stress, but then also decreased social support, right? There are certainly, if you are looking in poor communities, there are actually a lot of ways that people are sticking together, ways that people are helping each other, and some of those escape the views of researchers, right? Who would then just look and say, okay, well, I don't see the social support, so it's not there. It does exist in poor and marginalized communities, but overall, if you have a group of people who are in a community that is experiencing a significant amount of stress, it also means that there are both interior and exterior forces that are designed to keep people separate and off balance in ways that are affecting their health. So I want to just give you a couple of definitions. So I already mentioned this phrase, but I want you to have a definition for it. Social determinants of health. These are the conditions in which people are born, live, work, play, live their lives. And that is, again, this broad, all-encompassing concept of health that is coming from a person's immediate environment and their community. What's really nice for somebody like me who's been thinking about health in this framework before there was really a name for it, the wind is now in our sails, right? Because it's not just about trying to get a person to eat right and exercise, right? If somebody can't go to a park because the parks are unsafe, or if they can't run down their street without somebody trying to shoot them, right? Or if you go to the park and somebody thinks that you're not allowed to be there, even if you are, then these are some of the interference things that are part of this conversation, right? So again, we were just talking about access. The access may be there or not. And so this concept, this framework has been really useful for framing all of these particular health issues that we see. And I'm just really grateful that this framework has kind of become the prevailing framework in both public health and it's growing in medicine. Because remember, as you know, my work is trying to make sure that providers understand their patients, because I'm in it for the patients as people. And providers never needed to know anything about or the active life. They never needed to know anything about their patients other than the time that they were sitting in front of them, right? Naked in a gown, right? And it's like, you have no idea what their lived experiences are. You haven't even bothered to ask. You never needed to know, right, in order to do your diagnosis and your treatment, right? But in order to prevent, you do need to understand this. And finally, there is an interest in both communities to use this framework in order to get to health equity, which, and I'm using here the American Public Health Association's definition, which is giving everyone the opportunity to reach their best health, right? So their highest, best health, which means addressing inequities in the places where people are born, grow, live, work, learn, and age. So you see how it's incorporating the social determinants of health into the definition of health equity. And so, again, what's really convenient is that in some ways there's kind of no going back. If we're going to get to the health equity piece, then it means that we have to talk about the social determinants. So I just wanted to show, and this is also exciting because it's the newest version of the 10 essential public health services. So in public health, if you are learning about what public health does, and they do a lot, not as many resources as they probably should have, but these are what's considered the essential public health services. And so a lot of that is trying to track diseases in the community, collecting data, making sure that there are laws on the books that are about public safety and that those are enforced. It's about building relationships and partnerships with people in the community. And this new version was updated in 2020 to put equity in the center. So before this, it had research in the center, which is cool. I love research, right? But I love equity more. And so, again, what's really exciting is that all of these little spokes in the wheel are built to contribute to equity, and that equity is supposed to be the thread that unites all of these really, really disparate, diverse public health activities. So the social determinants of health are broad though, and I just think that's really important to say. Technically, anything can count as a social determinant, which is a potential threat to its overall success, because it's like, well, if everything can be health, then nothing is. And it's like, okay, but all of these actually relate, especially in a country where your health insurance, or you have a job that hopefully provides you health insurance as a benefit, and then if you don't have those things, then you automatically don't have health care, right? So these things are a little bit more tightly linked together in the sense that if you don't have one of these, like economic stability, then it becomes much harder to have health. In other countries, there's a little bit more of a safety net. There's also, I guess, a little bit more of a human rights-based approach that by virtue of being human, you are entitled to health care. And so there's a floor that is created to account for everybody's health that we don't have in this country. So these are just some broad domains. If you went to a different website, you might have 6 domains. In fact, I have another slide that I think splits it up into 6 or 7. It's not about the number of categories, but really just thinking about, again, what's in the environment, what is the social context, how are people relating to each other, who has access to education, and what is that quality, and the same thing with healthcare, right? So here, again, this is actually split up into 6 categories. When you look, these become the important health issues that need to be addressed in order for a community to be healthy. Do any of these stand out to you as surprising, that you wouldn't have expected our health? You're shaking your head no because you know that every single one of these is important. Thank you very much. So I just wanted to take it all in. Martha.
What is functional limitations mean? What's that?
Which one is it under?
It's on the bottom line. The last phrase.
Oh, right here, functional limitations. Oh, okay. So what the graph is showing is that depending on what somebody has or doesn't has, it can lead to things as having a high or a low life expectancy. Your mortality and your morbidity may be under threat. That your limitations as far as cognitive, as far as physical, that these can affect or be affected by your ability to essentially move and think and be like in your universe. So someone may end up with more limitations because some of these other things are not accounted for. Does that make sense? Oh, sure. Sure. Yeah, no problem. So let's say that you have somebody who has diabetes, and their diabetes is kind of rampantly unchecked, right? And so their blood sugar is spiking all the time, and it's not really under control. That person is going to end up with, unfortunately, more chronic health issues, and they may also be at risk for amputation of limbs, right? So that person, because of their diabetes, may end up with amputated limbs, which is going to make going through their community much more difficult if there are things like issues of walkability, right? And walkability is a term that, of course, assumes that somebody has both limbs and is able to walk, but it's actually more broad and involves like just being able to move, right? So somebody's diabetes can affect their ability to move through space, right, in public, and it can be further exacerbated if, for example, there are buildings that decided not to adhere to the ADA, right, the American Disabilities Act and things. So these issues can very easily compound upon each other in order to make somebody's quality of life worse. Does that make sense? Cool. So the world is watching. There was a United Nations report that came out a few years ago, and what their major finding was that the United States discriminates on the right to safe water and sanitation, which was kind of shocking, of course, to the broader community, because of course sometimes the United States likes to listen to the UN and sometimes they don't. And so this automatically became one of those like, we don't have to listen to you. Right? We don't have to listen to you. We're gonna show up to the meetings sometimes, but like, how dare you talk about us? So why would this person have said this, right? Why would this expert have done their research and created this entire report? So here's why. So what this person had seen is this series of water discrimination in a variety of different ways across the United States. And I've actually updated the slide so that you can see that there are actually several places where lead poisoning has happened. Unfortunately, a lot of them are in Michigan, but that's just by virtue of the fact that their water sources are failing, but they're also becoming more public. So there are plenty of not public places who have lead problems that have just not made it to the news. So unfortunately, Michigan is taking a hit right now as far as their water issues. They are not the only one. So I just wanted to defend Michigan for a second. Okay, so in Detroit, the municipal water facilities, right, the utilities, were shutting off people's water for non-payment, right? Water is life, and it's not something that people can do without easily, and it's also considered inhumane, right, to not have water. So usually what should happen is that people would just continuously be billed, and that they would rack up a large bill that maybe they could eventually pay down, that it wouldn't be shut off. Do you see the difference? Another example is that in Boston, depending on where you lived, which of course is totally related to somebody's race because of the segregation that has already been set up in the town, that the water pricing wasn't the same in different neighborhoods. And the more brown you were and that your neighborhood was, the higher you had to pay for your water. So another thing is that Native American households, a significant percentage of them do not have access to safe water or wastewater disposal, right? And that also then ties into some of the protests against pipelines coming through the water facility, the water areas that they wanted to protect, right? So there's also, again, you've seen these examples of cities where lead pipes that have not been taken care of properly, right? And I just want to point out, lead can work for sanitation and has worked for a really long time, but the pipes have to be continuously lined with a non-lead source in order to prevent corrosion from happening, and then the lead actually leaching into the water. And lead is odorless, colorless, and you won't know, right, that it's there, which requires also constant monitoring. And so there are several cities where we have seen that there is lead leaching into the water supply. And these are people who, of course, are also paying their water bills, right? So they're paying their water bills for dangerous water. And then finally, we have quite a few homeless communities, and they do not have access to running water or toilets, right? And so that brings me again to the question of, well, what do you want for your community, and what do you want for other people? So I just wanted to give you just a couple more definitions that are related to environmental justice. What I think is really interesting is that some of these large federal entities have started to adopt the language of really remarkable researchers like Dr. Robert Bullard, who has several decades of data and books and knowledge, right, in order to point out that where you see issues of environmental degradation, you also tend to see that the choices that powers that be in cities and states, that they're choosing to put the waste, not necessarily where people are poor, that doesn't help, but also where they are not white. And so what you end up is there are sometimes, as he has found, that there are even communities of middle class Black neighborhoods where they are saddled with a landfill, for example, right? And what I find really interesting is that the EPA, right, the Environmental Protection Agency, has now actually adopted some of the language of environmental justice and is using it to guide their activities, to guide their policies. So, and you can see actually that some of the language here about the idea that all people have a right to equal protection and equal enforcement of these environmental laws. And you see the same language. Yeah, go ahead.
In the previous slide, you talked about, you said Boston, racially skewed water pricing. How would the water company excuse that in different communities? What is their, how could they possibly, what's their explanation?
So can you repeat that question since Steve doesn't have a microphone?
Yes, I will repeat the question. So the question that Steve asked is, using Boston as the example, how could the Boston municipal water supply, right, how could they justify doing this kind of skewing of pricing? They just said they could.
Is that more a factor of Boston being served by more than one water provider?
Well, sure.
Can you repeat the question since
yes.
he doesn't have a microphone?
Yes.
Let's hold the questions till the end if you don't mind. Thank you.
What was your name?
What?
What's your name?
Kathy.
Kathy. Okay, so Kathy's question is about, well, isn't it because there's more than one water supply? And if I remember correctly, with the case of Boston in particular, it's not, I mean, there are multiple water sources, but it's the city of Boston that is still providing water to all of these different neighborhoods. So it is their kind of sole responsibility, and yeah, for reasons that they were using as their own justification, that they were pricing differently. So this question is actually about, well, what are some local environmental justice issues in your community or nearby if you live in a community that has shifted the burden to someone else? Okay, so I'm going to ask it again. What are local environmental justice issues in your community or nearby if you live in a community that has shifted the burden to someone else? And I'll just take a couple of hands.
Housing.
Go ahead.
Locally, it's housing.
It's housing, you said?
Housing.
Too expensive. It's environmental justice issues, housing.
Okay, so Steve mentioned housing. We'll do one more. A local environmental justice issue.
Air conditioning in Florida.
Say it again.
Air conditioning in Florida.
Air conditioning is a local, well, so I'll expand on yours to heat and heat issues, right? So if you live in a city like Winter Park that prides itself on its tree canopy, that maintains its tree canopy, that means that it's overall cooler, right? Especially with these brutal summer months. But there are other areas here in the county even, you don't have to even go far, where you find almost no trees, and you find that people's health is negatively impacted by the heat, and certainly even just something as simple as the sun, the heat radiating off of concrete, right? So if you think about Kissimmee and how much concrete they have and how few trees they have, right? You're gonna find different heat-related health issues in a place like Kissimmee versus here in Winter Park. One more.
And it would make the cost of air conditioning go up.
Well, yes, exactly, and it would therefore make the cost of cooling your home, right? You can be comfortable, go up quite a bit. Yeah, absolutely. Another thing to think about is just trash, right? Where does your trash go? I know that there's the convenience of not having to think about that, but unless you know where your landfill is that your city takes your trash to, if you don't have the landfill in your own community, then that means that that responsibility has been shifted to a different community. Go ahead.
My understanding is the city of Sanford has ignored flooding in Midway, and they refuse to mitigate, to take care of the problem, yet in other parts of Sanford they have.
So tell me your name again?
Deb Judson.
Deb.
Yeah.
So what Deb is saying is about the city of Sanford and how in relation to flooding that they've chosen to kind of do some mitigation efforts in some communities and not others. Right. The easiest explanation is that this is about resources and about not being able to truly mitigate in the way that they would like, but that also means that when you don't have the resource, or you choose not to have the resources to allocate, then that means that it becomes a priority of, well, who matters, right, and who doesn't. So when we talk about health disparities, it's important to understand that these are things that are considered not only unnecessary, but they're avoidable and unjust, right? So disparity as a word simply implies difference, but it's really important when we're talking about health disparities to make sure that the inequality piece and the unjustness is still part of the definition, because it's very easy then to say, okay, well, these are just differences, there's no reason to try to do anything about them, right? Because these are just differences that happen. No, there are some real health disparities that are changeable, that are fixable, and that they are created because of some sort of unfairness, right? So that means that these are policy decisions. And I think that's the most important, if you remember anything that I said, that I don't like pie charts and all these other things, remember that these are about policy decisions. These are very deliberate policy decisions that are related to kind of what you're saying, Deb, right? That you have laws that are created that might be designed to be equitable, but then are applied inequitably. Or the laws are written in an inequitable way and then are then enacted in an inequitable way. So I say all of this to say that if we're going to, if we're going to address these particular inequities, then we need to look at the social determinants of health, but we also need to look at policy and create policy or revise policy that will address those determinants at the community level. So, in addition to this, I just want to show you a couple of things. So you saw this with the dots. The American Public Health Association has a whole wealth of pieces of information, and I really like their topics and issues list. And what it's showing you is that if there's a particular topic that interests you, and I'm sure we have enough people in the room that there's probably individual topics that are of interest, this website will provide you with really short fact sheets of maybe just a couple of pages that will highlight what these issues are, where they come from in the United States, and then also what can be done about any of them. And so I just want to scroll so that you can see that essentially these are the topics of interest for the American Public Health Association. Probably these are also important topics that are important to you. But if there's something that you're interested in, then definitely check this out, because it's very nice kind of nutshell versions of getting a lot of really great information at the same time. And then I wanted to show you part of a clip. So this is a new video that was created. I only saw it for the first time maybe in the last couple of months, but and it's something that I plan to incorporate into the Intro to Public Health class. But it's called Segregated by Design, and again, it's reinforcing this idea that these are policies that have shaped neighborhoods, that shaped communities, and therefore this is also why you can see some of these health disparities. So this piece is actually based on the book The Color of Law, which I don't know if anybody has read it. I know you have. And it's actually also narrated by the author of The Color of Law. So we'll just watch a little bit of it. It's 17 minutes total. All right, so that's it. That's all you get. And this is just about housing, but if you look at what's I looking for? You can look at, and I have this actually that I do with my students, I have them look at the redlined maps from the 1930s, and then I have them look at some of the health indicators that the CDC has put together, and with the exception of a few places, especially if they're on the water, that did some sort of urban renewal, where you see these literally redlined neighborhoods, you see also the people who have the worst health outcomes, and that's along any of the kind of major topics that you see at the APHA website, right? So if you're looking at something relating to asthma, if you're looking at chronic disease, those redlined communities, and this is now, what, we're almost 100 years out, those effects continue to have health implications to this day. So I say again, if we're going to eliminate disparities, we need to look at policy, because it was policy that created these issues, and figuring out how to reverse these trends so that everybody can live to their highest level of health. Thanks very much.
I think you answered most of the questions, but we'll see if there are some more.
Sure, I usually do interactive presentations, so I...
Hopefully not. Hopefully no more. Everybody good?
No.
All right.
Hi.
Hi, what's your name?
And I was kind of shocked at your soft treatment of the question of medical work. My brain.
Hold the mic up just a little bit higher.
Sorry.
That's better.
Okay. Medical care in medical care in Europe compared to the United States. You know, the fact is that, America, people spend twice as much as people in Europe do. Isn't it true that it was a lot worse than you described in that?
Oh, I mean, I didn't want to get too down deep into statistics, because those can be very depressing, but I can. I was just choosing not to. Yes, Americans spend, so there are other countries where people are spending more on their taxes, right? They're spending like maybe 50% of their income on taxes that go to the government, but their government is providing many, many more services like healthcare to their citizens and to their residents. So here, this is a system which is much more privatized and much more fragmented, and so that means then that overall the costs of things, even if it's the same medications that somebody's taking here in the United States than someplace else, those tend to, Americans are paying more for the healthcare visits, they're also paying more for medications and for treatments than in other countries. Yes?
I wanted to say that voting matters, and that's why I really want to be, well, and I'm saying the Black community, we want to help them be able to vote more. Do you know what I mean? I think when you said policy and local government, it starts with power and who has power. And if people don't vote, like I can call the police and they're there like that, because where I live, people have power and they vote. And they vote these people in. And the same people keep blocking African Americans from voting. They keep making it more and more difficult. So what can you say about voting and policies, and what can we do to be proactive in helping that issue?
Oh, sure. I mean, I also just want to add that when you call the police, right, and they're there quickly, you also have the assumption that you will not die as a result of that interaction, right? And that's why you would want to call them. There are certainly some communities where you do not want to call the police and engage with them in any way, because who knows who is going to actually survive an interaction like that. As far as voting is concerned, right, voting is a part of being in a healthy society, right? And there are, it should not be, I think about other countries where the voting is compulsory and you have the ability to opt out, I guess, if you don't want to, and we have a completely opposite system where you have to opt in and stand in line, and people are now not allowed by law to feed you while you're standing in line, and there's intimidation. And so there's a lot of, we do things here where there's a lot of obstacles, and the darker your skin tone is, there are even more obstacles to doing just the simple things that are part of being a citizen. So yeah, I agree with you. I think the voting is important. Because by voting, you are showing that you are making a choice about who you want to represent you in the creation of these policies, provided they do their jobs. Yeah. Hi.
Hi. So, if we were to wave a magic wand and eliminate all of these very important inequities that you raise, we're still left with the issue of food quality in our country. When you talk about policy, I feel like we have a policy problem surrounding the information about food and food quality and sourcing and sustainability in this country that you don't see elsewhere. One very basic, simplistic example that I share is we all think that we're eating healthy and we want to feed our children and we want to feed ourselves, and you think about, I'm going to make my kid a peanut butter and jelly sandwich and some yogurt. Okay, and you think, well, what?
I know exactly where you're going.
Right. You read the ingredient label on peanut butter and it's a paragraph long. If we want a healthcare-based approach to food, how can we talk about these things and implement policy or advocate for policy that lends to some transparency and to our ability to make better choices in that area?
Sure, thank you so much. I mean, I want to quote the gangsta gardener first, right? Who says that you should grow your own food, right? That is the way that you can make them have the most control over what you're putting in your bodies, right? Reading labels is really hard. And the USDA does have websites that point out, right, how to read a label, and but the labels are not giving you all the information that you need because it doesn't tell you how much sugar you're supposed to have on a daily basis, right? So next time you look at a food label, it will show you the percentage, right, of your recommended daily value or daily allowance. there won't be one for sugar. It'll tell you the grams, but it won't tell you how much of that percentage. It's actually only supposed to be 4 or 5 grams a day, but all of our foods have way more sugar than that. So,
and can you just say, and that's a direct result of the sugar lobbying for that?
Yes, and if you want to find out more about this in particular, Fed Up is a really good documentary that I actually show to my students, right, to talk, that looks at specifically sugar and the interference that has happened in some of these policies by these large corporations that want to make sure that people will continue to buy their things.
I noticed when I looked at the chart of the life expectancies,
yeah.
I know that there was one main factor that really separated people from other countries is our gun violence.
Sure.
I heard that gun violence is one of the main causes of death for children under 18.
It is now.
Has there been any way of saying loud and clear that this gun violence is a health issue, not just what they call a freedom issue or whatever?
So the APHA has a fact sheet on gun violence, and I would direct you to that so that you can kind of see how they're framing it. When we're looking at issues of unintentional injury, gun violence, like you said, is it is the #1 leading cause of injury and death in children, and that did not used to be the case, and it's really tells you a lot about, I guess, the United States, because there are other countries that do have guns. It's not that, right? But I would say look at the APHA fact sheet, because it does a really nice job of kind of laying out not only some of those statistics, but also some of the laws that have been involved in where gun violence intersects with healthcare. A few years ago, Vivek Murthy, who is the Surgeon General, had said that gun violence is a health issue, and that was controversial. But if you talk to any trauma surgeons, those are the people that they're seeing, that they're literally trying to patch up the holes in these people that should never have been there in the first place. So yes, that's the answer to the question.
Thank you.
Yes. Oh, and then my other personal soapbox is that, since we're talking about soapboxes, is that as part of my fellowship, I am working here in the county on HIV prevention, and so we're conducting interviews with Black women to understand how their identity intersects with the healthcare experiences that they're coming across here in the county. And so if you are a Black woman, if you know a Black woman, scan the QR code on the left. And if you are a medical provider, I'm interested in interviewing you too. And that would be the code on the left. And also I have my email address there.
My name is Jody. I'm wondering if there's any way to find medical providers that specifically take into some of these factors into their practice.
That's a good question. So, you know what I'm finding as I've been trying to talk to more and more medical providers is that the field is slow to change, right? The technology is increasing, but they are still very much caught up in I have 10 good minutes that I can spend with you, and so that makes it much more difficult to get at some of these broader patient issues. At the moment, what I would say is that all of us need to become the proactive patients who raise the subject with our medical providers and push those 10 minutes talking about what we want to talk about when we're in front of them until they can come around to reforming their own system that will incorporate more time. One thing that has happened in the last couple of years that's kind of blowing my mind right now is that some of the social determinants of health have now become billable. So let's say you're a person who has a transportation company and you take people to their medical appointments. So before, that owner would not be able to bill they would be able to bill a person's health insurance like a provider, but now they can. And it's all under this category called social determinants of health. Do we really want more people to be able to bill health insurance to add to your costs individually? No, but is this the framework that we have in order to like push the question? This is what we have right now. So it's a really interesting new frontier that is literally just starting to kind of crop up, to the point now that I'm starting to hear about venture capitalism and this idea of a social determinants of health industry that didn't exist before. I don't even know what it is, but it's brand new.
Sounds like it'll make some money.
Oh, I know. We should all figure out how to make some money. Thank you for your question.
Medicaid. Florida did not take the federal Medicaid money and they refused to do so. Could you talk a little bit about how serious this is for our disadvantaged and poorer populations?
Yes, it's bad. It's problematic because there are people in the state who make too much for the very low limits that qualify for Medicaid. And so what the expansion that the federal government was offering was trying to do was say, if somebody makes this much money more than what our usual cutoff is, I mean, and I think the poverty level in Florida is like $10,000, $11,000 a year, which is very, very low. A person who has a job or maybe even 2 jobs will automatically exceed that. So that's what you're getting at.
Well, you can qualify for Obamacare if you make $13,200. If you're under that, now what?
Right, and so that's why the Medicaid expansion that was offered was useful for what some people call working poor people,
Yep.
right? Because then it was going to create an opportunity for them to be above the poverty level, but not necessarily able to afford or have a job that would offer them a health insurance, like a private insurance as a benefit. So that by not expanding Medicaid, it has created more difficulties for that subset of people who have 1 or 2 jobs, but not the kind of jobs that give them private health insurance, which means that their families, their own individual persons are at increased risk for a lot of diseases, unfortunately, right? And so you can almost guarantee that their quality of life, their quality of health, their life expectancy will all be worse simply because they are in this funky spot where they make too much for one program and not enough to be in a different one.
You have a question?
Thank you for your question.
Don't food deserts also contribute to bad health?
Sure they do. I actually, instead of the word food desert, I have moved on to food apartheid. And that is a specific phrase that was coined by Karen Washington, who is a food activist. And the reason why I like food apartheid is because deserts almost imply that just something won't grow, but
Companies specifically don't want to go.
right, well, because their main goal is to make money, right? You can't fault them for that. That's literally how they're built, right? Don't get mad. That's literally how they're built. So that means then it has to be some other incentive that is important for a corporation, right? You never see Whole Foods in poor neighborhoods, right? So there has to be another incentive for there to be healthy food in communities that need it. And that's all communities because everybody needs healthy food. Thank you for that.
Excellent question. I have one last question. When you showed one of the tables, there was the word equity in the middle.
Yes.
And that leads me to think about the current changes in our educational system here in the state of Florida. And I'm wondering if, as a result of what is happening, are we still going to be able to have university students taught about this?
About what?
Any of it? Any of it, but the inequality of healthcare.
Okay, so that's a really good question. I don't have an answer. I think it's going to be very, very interesting to see going forward how do these little kids and what they've been exposed to, right, as far as health sexual health, right? How does that actually work upwards when they become adults, right? I teach a 15-week course on HIV, the HIV pandemic at Rollins, and I don't even ask it, but it always comes up where the students start to talk amongst themselves in class about how they learned about sex, how they learned about HIV, and some of them are coming from counties that did a comprehensive sexual health, and there are others that received abstinence only. And that makes all the difference as far as their own personal preparation for what may be coming their way. And a lot of them talk about what a disservice it was where their parents didn't talk about anything with them, but then the schools didn't either. And so they were, you know, they felt like if I looked online, I didn't know what kind of information I was finding and how factual it was, and didn't know where to turn. And so these are the things that these young adult students talk about in the classes where, that I am in. I think it's going to be, I think what we're going to see going forward is these kind of initial hits to health, and then these longer term problems as far as backsliding, as far as some of the health outcomes that we're seeing, right? I don't know if it'll move the needle as far as where, it's as far as Florida is concerned, but it certainly could. But these are things that I'm thinking about and talking with people about every single day right now.
Yeah, it seems so incredibly important. Thank you so much. Yeah, thank you.